This is Antihypertensive Medications with Mrs. McGee. A review about hypertension is that it is defined as a systolic blood pressure greater than 140 with a diastolic blood pressure greater than 190. This is a sustained blood pressure, not a one-time only situation. A healthy blood pressure is less than 120 over less than 80. Check out the table below to remind yourself of what pre-hypertension and hypertension stage 1 and hypertension stage 2 are defined as for your test. Symptoms of hypertension are usually non-existent, but if there are some, they can include confusion, ear, noise, or buzzing, fatigue, headache, irregular heartbeat, nosebleeds, or vision changes. Blood pressure is elevated in about 30% of adults in the United States. Chronic hypertension can lead to heart disease and stroke, which are the top two causes of death in the world. And then hypertension is also a huge risk factor in developing chronic kidney disease and heart failure. Check out this visual aid about antihypertensive. It talks about two different categories of classifications of antihypertensives, which is the easiest way to learn these. The top one in the silver and red are calcium channel blockers. They include Norvasc, Kalin, Procardia, and Cardizem. These block calcium to keep the blood pressure down. You have to watch for these side effects, including hypotension, peripheral edema, flushing, headache, GI upset, and then down in the bottom, in the pink, are the beta-adrenergic blockers, or for short, beta blockers. We have metoprolol, atenolol, propanol, and nadolol. The side effects associated with these are bradycardia, hypotension, CHF, peripheral vascular disease, bronchospasms, and impotence. You can see the doctor's pointing at this team, and he says that no one should stop these without a doctor's approval. They can have rebound hypertension or other important problems. Back to the beta blockers, the bronchospasms include asthma-like symptoms. So if a patient has asthma, you don't take a beta blocker. Remember your suffixes, making these things easier to identify. LOL is the easy one for beta blockers. Find your common suffix for calcium channel blockers. If you are a note card person, write calcium channel blockers on the front. Make yourself learn the examples so that you can learn these as a classification. Speaking of classifications, we have two different classifications of blood pressure. Primary hypertension is when the cause isn't really known. It's 90% of. It can be known as essential or idiopathic hypertension. And then secondary is about 10% of the cases, and it's because of something else, such as like eclampsia, renal artery disease, or a pheochromocytoma. There are some non-pharmacological ways to treat hypertension, and you have to be familiar with that also. This will be the first line of treatment from any provider. That top one there is obvious. We should quit cigarette smoking if we cigarette smoke. People should be having a regular exercise routine, and you can restrict the dietary intake of salt, saturated fats, and of course calories. Calories, because if we lower our weight, our blood pressure comes back into normal range. All these are going to improve peripheral circulation, prevent increases in blood volume and reduce plasma cholesterol levels, bring yourself to a healthy total body weight, and get healthy in general. So here are the categories of antihypertensive agents. All of these dots should be an index card if you're an index card person, and then on the back should be the examples of them. So adrenergic agents, angiotensin converting enzyme inhibitors, otherwise known as ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, diuretics, and vasodilators. The very first one, the adrenergic agents, is the beta blockers. It's just a different name for it. So here we are. This is a visual example of all the different types of categories of antihypertensive drugs. And it gives you example medications, it gives you a way to remember them, and it gives you the suffix if there is one. So at the top, we have the ACE of hearts because we are talking about the cardiovascular system, and we're talking about ACE inhibitors. So there are your three example medications, captopril and elapril and benzapril. Guess what the suffix is? Pril. In the center is the beta blockers. We have three examples for it also. It's propanol, atenolol, and metoprolol. And you guys should remember that the suffix in this one is LOL. Down at the bottom, we have calcium antagonists with a little bottle of milk, because guess what? That is where you find some calcium. Now, it does not have a suffix for this particular category, so you're going to have to remember these. We have verapamil, diltiazem, and nifedipine. Specifically talking about the ACE inhibitors, again, if you need to know what ACE means, it's angiotensin converting enzyme. We're back to our suffix, the card, and the example medications. The action of ACE inhibitors actually decrease peripheral vascular resistance. So peripheral vascular resistance is important for you to understand. That means in my peripheries, my hands, my feet, my legs, my arms, my vascular, so my vessel resistance is not high. It allows the blood to flow easily. So if we decrease the vascular resistance, we're allowing the blood to flow to our extremities without resistance. So that allows us to keep our cardiac output the same, keep our cardiac rate the same, and keep our cardiac contractility the same. That's not increasing these things and keeping our heart working well. So decreasing peripheral vascular resistance is a good thing, but it causes some side effects, as all things do. Anytime we're treating blood pressure, high blood pressure, we can get hypotension. This one in particular causes orthostatic hypotension. So you may be fine sitting in your bed or lying in your bed, but then when you stand up, you could get hypotensive, causing dizziness. These ones are also known to cause GI distress, cough, and headache. So here's some more about ACE inhibitors. We are in Vegas this time, and we're still talking about the ACEs, the cards, and they're winning. It gives you a couple more examples. You can write those down on your index cards. Make sure that you add a couple things to your side effects. These can also cause fatigue, renal insufficiency, and if you didn't get cough on the last one, cough is important because some people have a chronic cough and will require to be taken off of specifically lisinopril because of it. If you jump back up to the top where it says World Series of Hearts, it does say that the ACE inhibitors work for hypertension, heart failure, and post-MI. So after a myocardial infarction, these are prescribed to patients also. So here's another slide about ACE inhibitors. They are a large group of safe and effective drugs. They're usually used as a first-line treatment for CHF and hypertension. So that means that a provider is going to look at them first because they're so safe and give them to their patients and hope that they work for them. It doesn't always work that way, though. They might be combined with a thiazide diuretic or a calcium channel blocker to work better. Now, let's talk about beta blockers. This is exactly the same picture as we looked at before on the combined slide, but this one lets us know what the action of beta blockers are. So it blocks beta receptors. That sounds logical, right? So what this does is actually decreases the heart rate, it decreases the force of the heart's contractions, and it decreases the rate of AV conduction. That all allows the blood pressure to lower. However, that decreasing of the heart rate can get out of control. As you see, the side effects, the very first one, is bradycardia. So it can actually decrease your heart rate too much. That in itself can cause lethargy. These medications can cause GI disturbance. I haven't met a medication once that hasn't caused a GI disturbance. They can cause congestive heart failure. They can cause decreased blood pressure. Just like I said, any medication that you give for a specific reason can work too well depending on the patient. These ones can also cause depression, and that's called beta blocker blues, and we're going to talk about that again here in a second. So here's some side effects again of beta blockers. If you didn't get them the first time, write them down now. In the center are examples of what beta blockers are. If you don't have them written down on your cards, do it. It can cause hypotension. We're going to start in the top left-hand corner and work our way around. It can cause symptoms of CHF, congestive or chronic heart failure. If you don't know what those symptoms are, they are coughing, shortness of breath, edema, and fatigue. And now we're on the right-hand side. It can cause bradycardia, so a low heart rate, and then it can cause drowsiness and depression. Moving on to calcium channel blockers. You can see in the blue line there, it gives you the suffix finally for calcium channel blockers, and it is not consistent throughout. As you can see, the first two in green don't follow that suffix rule, but the next four, 5, 6, 6, sorry, do follow the rule. Write all of these down so that you will know them. The 6 that are easy to identify because of the suffix, maybe those aren't the ones that you're going to absolutely memorize. Memorize the suffix and memorize the 2 examples that are kind of strange, because you can identify the other ones due to their suffix. So let's talk about calcium channel blockers. Over here on the right-hand side where it says very nice drugs, that is a mnemonic phrase to help you remember the names of some very common calcium channel blockers, which are verapamil, nifedipine, and diltiazem. Let's talk about the action. What do calcium channel blockers do in the body? Well, guess what? They block calcium. They don't allow the calcium to enter the cells, which decreases the ability to contract the heart and the conduction of the heart's electrical system. It also decreases the demand for oxygen in the body. So all of those things allow the blood pressure to go down. Guess what the side effects are, though? Decreased blood pressure. We can always decrease it too much. Bradycardia, because we're decreasing the conductivity and contractility of the heart, it may actually decrease too much. We may cause, with the next one, it says may precipitate AV block. So an AV block is an arrhythmia of the heart, because the heart's not doing what it's supposed to do, that is due to this medication because it's blocked too much calcium. We're not able to even conduct enough to make one QRS complex. Then, of course, we've got headache. This one is new for this medication. It's abdominal discomfort, so like constipation and nausea. The earlier medications that we talked about just said GI distress. And then this medication can also cause peripheral edema. More calcium channel blocker inflammation. They cause smooth muscle relaxation and prevent muscle contraction. They can cause decreased systemic vascular resistance, and then finally make decreased blood pressure because of that. So this is beta blockers. Side effects, I'm sorry, this is out of order for some reason, but the side effects of beta blockers can include dry mouth, drowsiness, sedation, constipation, headaches, nausea, cardiac disturbances, sleep disturbances, even a rash. Obviously a high incidence of orthostatic hypotension. So these are adrenergic antagonist blockers. In the middle, you can see that they have your examples listed for you. We have Cardura, Catapres, and Aldomet. They can cause orthostatic hypotension. If you don't understand what orthostatic hypotension is, you need to review that because I've said it on every single slide. These medications can cause vertigo, palpitations, and sexual dysfunction. Clonidine, which is one of these medications, also known as Catapres, it can decrease the blood pressure like we want. It can also be given through a transdermal patch and by mouth. This one is something that you're going to start with a very small dose and find out what works for the patient. We're also going to monitor EKG strips when we start this patient on Clonidine. We're going to monitor for liver dysfunction. So that means we're going to get liver function studies for this patient. It can cause numbness and tingling. Vasodilators, next medications that we're going to talk about. They include hydralazine, minoxidil, and nitroprusside. Don't get nitroprusside confused with nitroglycerin. They aren't the same. These ones act directly on the arteries and veins, and these are given only for resistant hypertension or hypertensive crisis. Resistant hypertension means that it is resistant to other medications. So these safer, more common medications that we've talked about prior to this, we're going to try that before we ever give these medications or consider giving them. Nitroprusside, also known as nipride, can cause cyanide toxicity. So this is very important that you probably check this cyanide level occasionally. We would adjust the dose for optimal therapeutic effects. The medication itself is sensitive to light, so we would keep it in a light absorbent container, like a darker container. IV bags of this medication come in a brown overlay of the bag. If we are given this medication IV, we're going to check the blood pressure every 5 minutes times 15 minutes, and then every 15 minutes until the blood pressure is stable. Remember, this medication we're given for a hypertensive crisis or extremely high blood pressure that is not responsive to other medications. So this is usually given in an emergency or a critical care setting. Excuse me. Diuretics. This should be review information for you guys. Remember that loop diuretics are the most powerful. They can all cause electrolyte imbalances, which lead to severe arrhythmias, seizures, and even death. Remember, potassium is the most common, but they can also cause sodium imbalances or calcium imbalances, depending on which medications that we're talking about. Patients have frequent trips to the bathroom, and that causes a lot of non-compliance as far as the patients go. Diuretics, the types of diuretics include, and this is review again, thiazide diuretics such as hydrochlorothiazide, potassium-sparing diuretics such as spirulactone or aldactone, and then the loop diuretics, which is Lasix, Bumex, and Diuretic. Adverse effects of diuretics include hypotension, bradycardia, fatigue, insomnia, and sexual dysfunction. Remember that abrupt withdrawal of these medications when they're given specifically for hypertension can cause rebound hypertension. So let's just give an example. If a patient has been on Lasix and it's controlling their blood pressure, but all of a sudden they decide that they have a funeral to go to. They don't want to take it because they don't want to go to the bathroom 100 times during this funeral. They've just caused themselves to have a hypertensive situation. Guaranteed with the stress of the situation, obviously, and the lack of their medication that their bodies become used to using, they're going to have a hypertensive issue. Remember, the drug-induced sexual dysfunction and the increased going to the bathroom can cause a lot of non-compliance. Non-compliance means that the patients choose not to take the medication. Hidden in this paragraph is also hallucinations, insomnia, lethargy. We want to be careful when we give these medications to patients who have asthma, acute heart failure, and peripheral vascular disease. Remember your nursing care of hypertension. We want to make sure that these patients are taking a daily weight. All of the medications that we've talked about can cause edema, or they change the vascularity of your extremities, so can cause fluid buildup somewhere. We want to make sure that our eyes and nose are matching so that we aren't taking in more fluid than the patient is putting out. Make sure you know their urine output. We don't want to cause any kidney damage. Normal urinary output for 1 hour is 30 for an adult. We want to watch the response of a blood pressure. If you're giving a blood pressure medication, you should know what the blood pressure is prior to giving that medication and then after the medication starts to work. We want to draw electrolyte labs and know what our electrolytes are. We want to take pulses. Remember that peripheral vascular resistance. All those peripheries, your extremities, where your pulse points are being changed by these medications. We want to watch for ischemic episodes such as transient ischemic attacks or mini strokes. We want to know that the complications of hypertensives or complications of hypertension are the 4 C's: coronary artery disease, chronic renal failure, chronic heart failure, and cerebral vascular accident. That is a card within itself. You got to memorize those complications. And this, if you didn't notice, diuretic down the left-hand side of these is a mnemonic phrase to help you remember what to do for patients taking hypertensive medication or having hypertension. More information about diuretics. I think that we've already talked about everything on that one. Here is a visual about diuretics. Delivery routes are up here at the top right hand. We have PO, IV, and IM. It tells you where in the body that these are working. In the nephron, in the loop of Henle, on a cellular level, these things are creating change in the body. And down here in the bottom in the green, we want to make sure that we are watching for weight change, making sure we have INO balance, dehydration, and hyperglycemia. Always checking for blood pressure, making sure we know what the sodium, the chloride, the potassium, all of those things are.